My personal approach to patient care is I'm very hands-on. I work with each individual patient from the time I see them in clinic to the time if they need surgery, to the time that we go to the OR, and to the post-operative care. I'm Douglas Bigelow. I'm Division Chief of Otology, Neurotology in the Penn ENT department. The focus of my work is really in the ear and the skull base. Anything related to the ear, whether it's hearing loss, chronic ear infections, facial weakness, the facial nerve runs through the ear. I deal with a lot of skull-based tumors, acoustic neuromas, glomus tumors, meningiomas. I think the most important thing is to take excellent care of the patients, try to help them and to make them better, and to be on the cutting edge so that we can give our patients the most up-to-date techniques, technology, procedures that can benefit them. The best part of our job is seeing patients and dealing with patients, doing the surgeries, taking a patient from having a particular problem and making them better. That's a pretty good feeling.